Okay, grade 11, welcome to your second lesson of the theme Family Dynamics and Society. Last time we talked about the effect of the COVID-19 on, of course, the disabled children and how they were not able to go to the centers where they were taken care of. And now we're talking about a different issue with the elderly who are unable to see their loved ones because of their weak immunity. Those are your objectives. Please take a look at them when you study the PowerPoint. Now, before we begin, we need to answer the following discussion questions. Name 2 ways how society was affected by COVID-19. How has quarantine or lockdown affected families, and what age group, specifically in the West, could find itself vulnerable and lonely? Of course, ways how society was affected by COVID. People's social lives have become greatly affected, less physical interaction due to distancing obligations. Of course, more and more people have to work and get education remotely, meaning virtually, with all the complications and shortcomings associated with that, poor internet, etc. Number 2, how has the quarantine or lockdown affected families? Of course, many families have a loved one who lives abroad and thus couldn't be seen during these times. Also, some families have reported an increase in tension between family members who are going through quarantine at the same place, for long hours and long days. And so there has been an increase in domestic violence. This is another way lockdown has affected families. Now, number 3, which brings us to our topic. What age group, specifically in the West, could find itself vulnerable and lonely, meaning weak, okay? And they're on their own. We know that in the West there are assisted living houses, meaning houses for the elderly, take care of the elderly who no longer can live with a family member because they need more assistance, and the rest of the family is either working or at school. Now, the elderly living in nursing homes, if you want assisted living homes, have suffered greatly in the West. They are unable to see their loved ones due to health concerns, since the elderly are the most vulnerable group with the highest death rates from COVID. So nursing homes are afraid to allow them to meet people, since the whole nursing home might experience a fatal disaster if an outbreak of COVID occurs there. Okay, so before we go into the lesson, let's take a look at the words we need to know. Of course, pandemic and quarantine, we talked about them last time. Cognitive, related to the mind or thinking. Impairment is a disability. The older a person becomes, the more impaired the cognitive abilities might become. Vulnerable means weak. Remote meaning far away. Permitted, allowed. Chronic meaning something that lasts for a very long time and it recurs. Assisted living, also called the nursing homes, special facilities where the elderly are housed to be given the proper care, of course. Advocates are people who work for a certain issue and defend it. Dementia is a condition where a person has loss of memory, language, problem solving, and other thinking abilities. The most common cause of dementia is Alzheimer's disease, where the brain cells and nerves start to die out quickly. Okay, nursing home families yearn to visit loved ones again. This is a very recent article. Read the following article about how the elderly were struck hard by the coronavirus pandemic, where long-term and assisted living facilities shut their doors to outsiders. Then answer the questions that follow. 3 years ago, Kathy Baum helped both her mother and her mother-in-law move into memory care in an assisted living facility in Reston, Virginia. Because Miss Baum lived nearby, she could visit 4 or 5 days a week and keep a watchful eye on them. I checked the bathrooms to be sure they'd had a shower when they were supposed to, said Miss Baum. who is 69. She stuck around at lunchtime to help cut their food or see that a staff member did. She made sure that her mother-in-law got the right clothing back and from the laundry. Then the coronavirus struck. On March 10, the facility, the place, like nursing homes and assisted living complexes across the country, shut and barred family visits. Miss Baum did not see her 98-year-old mother or her 82-year-old mother-in-law until administrators again permitted visitors on June 20. Even then, the experience proved frustrating. At first, employees escorted residents into an outdoor courtyard where family members could talk to them over a wrought iron fence. It's as if it's a prison. When the weather became too hot, the facility rigged a plastic curtain at an entrance so the residents could sit in the air conditioning while relatives visited. Miss Baum isn't sure how much the two women understand when she, her husband, or her brother try to communicate through the barrier. Cognitive impairment, meaning, those elderly's minds are affected, they have an impairment, makes phone calls and video chats unworkable. They appear to be well, she said, noting that the women didn't seem to have lost weight and had visited the recently reopened beauty salon. Distance dining room service has resumed. But Miss Baum is having trouble sleeping. When I could check on things, I could go home and not worry, she said. Now I can't check. In the early weeks of the pandemic, a shutdown made sense to experts. We faced so much risk, said David Grabowski, a healthcare researcher at Harvard Medical School. It was a crisis. More than 40% of those who have died from COVID-19 were long-term care residents or staff members, a New York Times database shows. So here it shows why this group of people is most vulnerable. Paragraph 8. Given such uncertainty about the new virus, Dr. Grabowski and others think the Federal Centers for Medicare and Medicaid Services made the right initial call in banning outsiders. Banning means disallowing, a policy that most assisted living facilities, which are not federally regulated, also adopted. We felt they were being responsive and protecting residents, he said. Now, a number of geriatricians. Okay, guys, geriatric, when you see this prefix, it means elderly. Geriatricians are, the specialists for the elderly, researchers and advocates, and frantic family members fear that months of restrictive visiting policies have become injurious, meaning hurtful. It's not just COVID that's killing residents in the long-term care, said Dr. Jason Karlawish, a geriatrician at the University of Pennsylvania. It's the isolation, the loneliness. Studies have repeatedly shown that isolated older adults have higher rates of heart disease, stroke, and dementia, and increased mortality rates. Mortality, of course, death rates, comparable to those linked to smoking. Moreover, Dr. Karlawish said, COVID exposes a secret everyone knows, that such facilities are chronically understaffed. It means they don't have enough staff, with relatives often filling the gap. The family were covert caregivers, he said, providing not just connection and stimulation, but hands-on help with dressing, walking, eating, and monitoring residents' health. In a study, Dr. Grabowski co-authored nursing home residents with dementia, meaning the disease where they're losing their brain cells, received better quality care at the end of life if a family member visited regularly. So this is how they are being affected. Could nursing homes and assisted living facilities start to resume family visits? Some already have, most commonly scheduling brief contacts outdoors or encounters through windows, sometimes supplemented by video chat and phone calls. But the response has not been universal. We are hearing that many facilities are refusing to permit visits even if they are allowed to do so. Robin Grant, Director of Public Policy and Advocacy for the National Consumer Voice, said in an email. Moreover, scheduled outdoor visits don't give family caregivers the same ability to participate in residents' care or monitor their conditions. Susan Thomas, who has been able to visit her mother only through the front window of her assisted living facility near Charlotte, wonders if anyone inside remembers that her mother, who is 81 and has dementia, needs her hearing aid batteries changed every other day. So those family members are really concerned about what's going on. Some have termed this isolation involuntary confinement, said Dr. Christian Bergman, a geriatrician and internist at Virginia Commonwealth University. We can't continue down this path for another 6 months. Okay, so this is the article. Now I would like to analyze this chart with you because it's important to go through this skill again because, you know, some of you did like sort of a bumpy job here. The chart below depicts the number of deaths by age and gender due to corona in England, coronavirus. Now, first of all, this is the main idea, or this is the topic of the chart. It's a bar graph, and it talks about coronavirus deaths in England in a given week. Total deaths to week ending 27th of March, the week that ended with the 27th of March. Let's take a close look at this bar graph. Age here, horizontally, and the number of deaths per week vertically. Age group 15 to 44, take a look, less than 20. 45 to 64, okay. Look at this trend, 65 to 74, 75 to 84. And then here, for the males, it's less, but the females, it's more. So it's going up. As you notice this, I drew this line graph, which shows generally an increasing trend as what? As the age increases. Blue is for females and the yellow is for males. Take a look. We also notice that males die at a lesser rate than females die at a lesser rate than males. Okay, I mean there is a significant difference in the death rates among males and females. Now my question, but of course you don't only answer the question, you have to analyze. What can you conclude about the number of deaths with regards to the two variables, age and gender? Now, this is how we answer it. First of all, the chart depicts the number of deaths by age and gender due to corona in England in a week. The analysis, we note that the age group between 15 to 44 has the least number of deaths, less than 20, and this rate increases almost steadily with the exception of males in age groups 75 to 84 and 85 plus, where more males in this age group died than the age group 85 plus. However, we notice that in all age groups, the death rate among males is higher than that among females. We analyzed. Now we need to make a conclusion and start with thus we conclude. Thus we conclude from the chart that as age increases, the number of deaths due to coronavirus also tends to increase, with males having more fatality rates than females. Fatality death rates. Okay? Now we need to answer the following questions after thinking critically, meaning organizational skills questions. Okay? In your opinion, what are the two devastating effects of the coronavirus on the elderly? Of course, we're going to answer that during Zoom Live. How relevant is the article and the story of Kathy Baum to your country? Is the situation of the senior citizens? Senior citizens is another term referring to the elderly. Different in Lebanon, explain. Now here, of course, this issue is more complex in the West because more elderly are placed in assisted living homes or nursing homes because most people are working. In our part of the world, it's still shameful to do so. Generally, most of the time, the elderly live with their children. They are not put in nursing homes. So this is how the situation is different. Question number 3, how would you describe the tone in paragraph 7? Explain. Let's take a look at paragraph 7. In the early weeks of the pandemic, a shutdown made sense to experts. We faced so much risk, said Dr. Grabowski, a healthcare researcher at Harvard Medical School. It was a crisis. More than 40% of those who have died from COVID were long-time care residents or staff members, a New York Times database shows. So what tone do you see here? Of course, the tone is worried, the tone is alarming. Why? Because the author gave the huge numbers of deaths among the elderly and the staff in assisted living homes. So this is it for our lecture today. Please study it well, study the ideas well, and of course, when you answer the homework questions, you need to go back to the skills and revise them. Thank you for listening and see you soon. Bye.